Hello everyone. So welcome again for this last day. I think we are all tired for these 2 weeks work. And so this morning meeting is gonna be on AMAX and what next. So we'll have two presentations. The first one from Caroline from the Imperial College. She will present the VIMC programs and how the goal and what they can do. We're going to also have another presentation from Koussay Dellagi from Pasteur Institute of Paris. And then you're going to have a round table where each one of you can give you the point of view, how can we do next, what's the important thing to do. So let's begin. And then let's discuss. Thank you.
Thank you, Slimane. Thank you for the invitation to come to Tunisia. I think it's working. Is it working? Okay, so I'm going to talk a bit about the Vaccine Impact Modelling Consortium, particularly focusing on what opportunities there are for you within VIMC. I didn't hit it, that was the problem. So I'm going to talk to you about the Vaccine Impact Modelling Consortium. So I'm Caroline Trotter, I'm an epidemiologist. I've been modelling infectious diseases for a long time, it's great to have this initiative, this AMAX initiative. I'm really excited to be here and learn more about it. So what is VIMC? Well, VIMC is an international community of modellers providing high-quality estimates of the public health impact of vaccination to inform and improve decision-making. So as we were talking about yesterday, it has this link with decision-makers and policy-makers to truly try and provide good evidence for them to make good decisions. And we tend to work on a global and regional level rather than on a country level, but we are, as our aims are changing, we will be doing more country-facing work. So this is a picture from September 2023, where we all met in the UK. There may be some familiar faces in this picture, but we're quite a large group of modellers, we had a very enjoyable meeting in the UK in September 2023. At the start of our second round of VIMC funding. So I'll start with, what does VIMC do? And I just have one slide on this for what we did in the first period of 5 years of funding. So VIMC is supported by Gavi and the Bill and Melinda Gates Foundation. And in the first iteration, when we started in 2017, what we were really aiming to do was produce robust estimates of vaccine impact for 10 Gavi-supported vaccines. Now this is quite straightforward on the face of it, but actually it's quite difficult to do at scale when you're looking at 112 different countries, 10 different vaccine antigens, and then 2 models per disease. So if you think about each model running maybe 6 vaccine scenarios over a course of 100 years, and then you multiply that by 2 for each disease area, multiply that by 10, you get your 10 disease areas, and you end up with a lot of data. There's a lot of information from those model estimates. And that's not a trivial task to manage that information. And so we developed some core infrastructure, such as a platform we call Montague, which allows us to share standardized model inputs like demography and vaccine coverage, but also to collect the model outputs once the models have been run, and then process all that information. So it was really about, in the first phase, about being able to set up the infrastructure to manage these vaccine impact estimates. And we had some pivotal papers that describe vaccine impact. This is a figure from one of the papers that Zhang Li was the first author on. And you can see in the figures that we have our estimates of impact with and without vaccination. So we have the counterfactual without vaccination. And what we're really trying to do is project forward the impact of vaccination with Gavi support. And, you know, it was really quite striking, the number of lives that could be saved by vaccination. So in this paper, we estimated that with these 10 pathogens, we'll have averted 69 million deaths between 2000 and 2030, of which 37 million were already averted in that first 20 years. So a 45% reduction in deaths compared with no vaccination. So really very striking vaccine impact, shows the importance of vaccination programs in Gavi-supported countries. So by the time we got around to refunding VIMC in 2022, we wanted to move the aims of the focus of the consortium in some particular areas. So we still wanted to be able to provide reliable and accessible estimates of vaccine impact across the Gavi portfolio, but we also wanted to be a bit more responsive. Often there'll be questions coming from policymakers about vaccine strategy that modelling could help with, and so we wanted to expand to address modelling related vaccine policy questions. And really, as with yesterday, recognise the importance of involving stakeholders in this process. So it's not just there's a question, go away and answer it. There's a question, there's a conversation about the question, there's a conversation about the data, and modellers do some work and come back and present their findings and then discuss this with the stakeholders. So it's really a much more of a two-way process. And by doing so, we hope that we translate the consortium's modelling to real-world policy that improves health outcomes. One thing that was very striking in the first iteration was that most modelling groups were from high-income countries, mainly the UK and the US, and we really wanted to change this and foster a diverse international community of vaccine impact modellers, being more inclusive of modellers in low and middle-income countries, which were the countries essentially that are supported by Gavi and where the modelling was informing vaccine impact and policy. And aligned to this, we want to provide training in infectious disease modelling to both modellers and policymakers, and I'll say a little bit more about this at the end. So it's a consortium. We have a secretariat based at Imperial College in London, but we have modelling groups from around the world. In VIMC 210, it's covering these diseases. We have cholera, COVID-19, Hep B, HPV, malaria, measles, meningitis, rubella, typhoid and yellow fever. So you think of these as the vertical disease-specific programs, but we also have these horizontal programs which are around a shared learning agenda. So to give an example, many of these diseases are outbreak prone, and there might be lessons we can learn from modelling across different outbreak settings. We're also looking at ecosystem building, how we support more modellers in low and middle income countries, for example, how we train modellers, and then another element that's cross-cutting is coordination across different disease areas, and as I mentioned, the importance of stakeholder engagement so that our models are useful. In the second iteration of VIMC, we also have an element on climate change and vaccine-preventable diseases. This is supported by the Wellcome Trust, and this part of the programme is led by Neil Ferguson, and we are aiming here to better characterise the mechanistic relationship between the environment, climate and disease transmission. And by doing so, then we can then assess the implications of long-term climate change for disease burden, range and routine vaccination. So it's really thinking ahead of the climate impacts for 5 climate-sensitive diseases and think about how control programs can respond to this changing climate. It's not just looking at sort of broad climate shift, it's also looking at more extreme events, which might be important for diseases like dengue and cholera, for example. Okay, so that's a bit about what VIMC does. I want to just next talk briefly about what opportunities there are within VIMC. Excuse me. So first of all, we have this new structure of VIMC project working groups, which aim to answer policy relevant questions in collaboration with stakeholders and then translate these findings to real world health benefits. So that's the broad aim. And then what happens in practice is that we identify a particular question from policymakers. The modellers are engaged in this question. I might have a series of meetings with the stakeholders. It's really the modelling groups themselves that are leading this, but they're supported by the science and policy team where needed. And most of the time, to date, these project working groups have been run by modellers already within the consortium, but we are also open to having requests for proposals issued. If we have a new question that isn't covered by one of the existing modelling groups will issue a request for proposal. So you should keep an eye out for these, because they might be in your disease area, and it might be a question that you can answer. And when we issue a request for proposal, you'll be asked to write a short case for support and say why your team is able to answer this question. And then, of course, there'll be funding attached to help you answer that question. Another opportunity we have is with the VIMC affiliate scheme, and this is really trying to support early career researchers who are involved in some aspects of vaccine impact modelling. We're really just trying to provide opportunities for networking and training. For example, several affiliates came to our meeting back in September. We currently have 12 affiliates who are based all around the world. If you're working on a vaccine impact modelling project, I encourage you to sign up for this. Do encourage people in your teams and networks to join. People do need to be working on a vaccine preventable disease and ideally have some link to VIMC to join, but it's quite flexible, and as I said, the idea is just to make you aware of different opportunities for networking and training. The next level we have is the VIMC fellowship scheme. So this is for people who are already modelling, they're already progressing in their work, and the real aim of the scheme is to facilitate collaborations between modellers in different institutions, and here we'll provide funding for fellows' expenses, so travel expenses, living expenses, where necessary, salary expenses. And we're particularly interested, although not exclusively, in supporting and building relationships between modellers in LMICs. And so there may be an exchange visit of 1 to 2, perhaps even 3 months, where modellers come and spend time at a different institution. This might be particularly helpful where you're at an institution where you don't have this critical mass of modellers, because you can then spend time with a larger group and gain experience from that group. So this is an open scheme. Excuse me. There should be a link. There should be a link to VIMC, or at least a VIMC member. But really, we're quite open to ideas, and I'd be very happy to hear from people in this room who think they could benefit from this fellowship scheme. And the last opportunity I'm going to talk about is we're going to be running a modelling short course in 2024. This is going to be generously hosted by CEMA in Kenya. So we're already partnering with key partners in AMAX, IP Tunis and CEMA. Keep an eye out for the details that are still being worked out, and I put a note for our website there where you can find out more about activities going on. So it's just a quick overview before I lose my voice of VIMC, but I'm very happy to answer questions, particularly, and do get in touch if you're interested in the fellowship scheme or the affiliate scheme. Thank you.
Thank you. We have some questions. Mark? Yeah.
Thanks, Coloring, for the good work you're doing with VMIC. I wanted to find out, because it's quite connected to policy, and you've done, I think, an excellent job with Gavi and WHO. When you think of the country level engagement and you've got nice fellowships for the modelers, how do you get the policymakers to spend a bit more time listening and talking about models? Is there like a policy fellowship?
We haven't had policy fellows, but actually we could have. There'd be no reason not to have that. And I think that's quite a good idea. So as I said, VIMC has tended to work on a sort of global level, global stakeholders like Gavi and WHO, or at a regional level. But I think increasingly this is now filtering down so that countries are seeing the importance of modelling. And so the fellowships are really quite flexible. If there was a demand for a sort of policy linking fellowship, I think that would be very open to hosting that. I mean, within different institutions, there are different strengths. Within Cambridge, there's a very long-standing Centre for Science and Policy, which is really trying to connect with UK policymakers, but we can learn from them about what their approach is about how they bring in policymakers. So I think it's a good suggestion, Thumbi, and we'll be open to that.
Other questions? No? Yes? Ask all the question you want. Student, if you would like to ask questions, please do it.
I have a question. I have a question for you then. If you're working on a vaccine preventable disease, raise your hand. Okay, so lots of you are. So this is relevant. We're really trying to. We'd be keen to engage with you. So.
So, yeah.
Sorry to have to ask again. But I imagine like you have malaria on this, and a few countries are now beginning to roll out malaria vaccines. Is VMIC involved like in the implementation and how to introduce new vaccines, that kind of analysis, or?
To some extent, it depends a bit on the disease. So, for example, for meningitis, the VIMC modelling group in Cambridge was involved in the SAGE working group, which sort of determined the recommendations. For malaria, the modelling groups have been involved, again, in informing SAGE and MPAC decisions, but not so much on a country level. I think that's where there's this slight disconnect at the moment that we would like to fill, in that the models have really been applied on a sort of global and regional basis, and not so much to inform country-level decisions. But they can be applied to that. And so I think it's there we need to get the link between the country stakeholders and the modellers, and actually support more local modellers as well. I think there's a real advantage of having modellers in context who know the epidemiology, and they know the country circumstances more than we would in sat in our offices in London.
Donc, I speak in French. Donc, merci pour la présentation. J'ai vu que vous travaillez, vous vous intéressez aussi au paludisme, à la fièvre typhoïde et les méningites. Donc, pour toutes ces pathologies, nous savons, surtout pour les méningites, il existe donc des vaccins. Maintenant, comment Impact Vaccine donc interagit? Est-ce que c'est l'appui par rapport au projet de recherche ou bien dans le domaine de la vaccination? Comment se fait cette interaction?
She's interested on malaria, typhoid, and the meningitis, and she was asking if in the case of meningitis, did you help for scientific research or for applying the vaccine as a strategy, how to say it, as a operational strategy?
Yes, so what we've been doing in the case of meningitis is looking at modelling different vaccine strategies. So one issue with the new meningitis vaccines were that they are more expensive than the existing Menafrivac, and they cover 5 serogroups, which is a good thing, but they are more expensive, and the burden of disease is lower because of the Group A vaccine was very successful in reducing Group A disease. So the question there was, how do we develop more cost-effective strategies? So there wasn't an appetite for immunising everyone aged 1 to 29 years in 26 countries, as there was with Menafrivac. And so the strategy then was that we used modelling to inform was looking at, can we reduce the age group? And the decision was to target 1 to 19-year-olds. And can we reduce the geography? And the decision was there to target the highest risk countries in the centre of the meningitis belt. So modelling was quite useful for deriving those strategies and recommendations.
Speak in French and translate. Pour le cas de la méningite, c'est évident que des pays qui ont des problèmes de méningite ou des problèmes de vaccination de méningite, comme le Niger, la réflexion sur l'application du vaccin à la méningite peut être très très pertinente, parce qu'en même temps vous avez des données, en même temps vous avez des problèmes, donc des choses peuvent être faites. I just saying that countries like Niger, where they have a lot of problem of meningitis, and also data related to meningitis, the long period of data, long tradition of data, they can be a good application of this type this type of countries.
Thanks for the presentation, Caroline, and for being here. So I want to ask about the training that you are do support for in Kenya in September 2024. So I want to ask if there is any kind of fellowships for the student to be part of this training, especially for the students that are participating in the AMAX project, or even outside the project.
Yeah, so the places on the course will be fully funded, so there won't be any expectation that people will have to pay for the course, but there will be a competitive application process. So we will develop an application form that we think will pick out the best students for the course. So it's based on a long-running course that was hosted by the Wellcome Trust for about 20 years. So it's a well-known course, and it's been adapted to look at vaccine impact. So I think what we're looking for are people who are just getting started in their modelling careers, because it is an introductory course. So I think people getting started will benefit most from it. But they also have to have an idea, have to know how they're going to apply it, even if they haven't got to that point yet. So I think they're some of the two key criteria we're going to be looking for. Someone who isn't already a fully fledged modeller will benefit from this introductory course, but they do have an idea of where they want to go and where they want to take modelling. And we'll be launching the application process in the next few months.
What about the students that already have some expertise in modeling? Do you offer training for them to get more expertise in different areas of modeling? As you know, there is different tools in mathematical modeling or even computer science. You have some training for them?
So this course is concentrating on transmission dynamic modelling. We will be using R for the course, and we don't have plans for an advanced course yet. This is really an introductory course that we promise to run. I think the opportunity for further training probably comes through the fellowship scheme, where someone's already got started and they think, oh, I would really benefit from talking and working with this person, and so I can go and spend some time there. I think that's probably a better route for more advanced training.
Thanks for the talk, Caroline, and happy International Women's Day.
Yes.
I wanted to find out about how do you put the balance between ensuring cost effectiveness, but then also having in mind that vaccines save lives. So I'm more interested in the balance between modeling for cost effectiveness, but then also for the life-saving opportunity.
So in the Vaccine Impact Modelling Consortium, the work we do is mainly looking at burden averted, so deaths, cases and DALIs. However, many of the groups are also experts in cost effectiveness. Not all of them, but many will do a cost effectiveness analysis alongside their modelling analysis. And it is an important consideration. So, for example, in the Gavi will have their vaccine investment strategy, and they will consider not just the potential for impact in terms of burden averted, but they'll also look at cost effectiveness. They'll also look at how this can strengthen health systems that have quite a wide range of different criteria. So I think they have quite a good approach for thinking about what vaccines have most value, but value is not just limited to cost effectiveness. There may be health security implications, for example. And so many of the modellers are working on health economics. We have the group here who are working on cost effectiveness analysis as well and providing expertise in that area. So it's not really in the core business of the Vaccine Impact Modelling Consortium, but it is a consideration, and the modellers are involved in this. It's always a balance. Decision making isn't easy. I think it's about providing the information, providing the sensible scenarios that people can look at, and then often this is fed into wider decision making processes like the Gavi vaccine investment strategy or the Gavi replenishment or WHO SAGE committees.
Research work in COVID time, we have applied MCDA model, multi-criteria decision analysis model, to prioritize candidates to COVID-19 vaccines when we are in the period of shortage of vaccines. So that was a small initiative from us, from a student, and completely volunteering initiative to do this research work. We have implemented a program of health economics in the Faculty of Pharmacy, and I'm interested to share about this program. So if I can have details about how long is the training, and if they can follow it online, because sometimes people are already in professional, they are already working, so I'm sure they will be asking if they can have the training online, and is it offered for students, or they can be in early time phase of their career. So yeah, and I wish we can have more information, especially for pharmacists and health economics, to advance our program in the faculty, and also opportunities for them to get this training, especially if they are dedicated for low and middle income countries. So I think that's a criteria we can already fit in, and we can further also progress our program. Thank you so much.
Thank you. So it's going to be an in-person course. We don't have plans currently to run an online course. I think if there was great demand, we might think about that later on in the VIMC cycle. We don't offer training in health economics either. Again, I think there's quite a lot of offerings run by other institutions, but I think what we'd quite like to do is to start a conversation about all these different issues in terms of vaccine impact modelling. So we have quite regular webinars, and if you sign up as an affiliate, you can join all the webinars, and we'll bring in these different elements about decision criteria or health economics, and really try to take a bit of a broader view than just the vaccine impact. So that's one way we're hoping to work. But I think we've had to think about how to concentrate our efforts, because like everyone, our resources are limited, and we thought this in-person modelling course would be a good way to really help a cadre of modellers get started.
So first of all, thank you for the presentation. So you mentioned that you are doing modeling for HPV and HPV vaccination impact. So my question is, do you consider cross-protection of available vaccines against variants of HPV that are not designed for? And if so, does the UK have studies of such cross-protection of the vaccines?
Oh, you're testing my HPV knowledge now. I can't recall off the top of my head which of the HPV models do account for cross protection. I think it may be restricted to the highly virulent types. And then the UK may well have data, but I can't point you to that off the top of my head. But thanks for the question.
Okay, thank you.
I'm just suggesting you to put you in contact with the team of HPV, and they can have this discussion together. Yeah.
That will be very helpful. Thank you.
Would like to have another question, remark, whatever you want. No. So thank you again. So next, I think we have presentation of Hi, Koussay. C'est Dellagi. Do you hear me?
Merci. Thank you. Do you want me to start?
Yes.
Okay, so I have asked, I sent yesterday my slides. Do you receive them? And I asked that you will propose, I propose that you present my slides and I will follow the, yeah, okay, it's okay. Very good.
Yes.
Okay. So my presentation deals with Pasteur Network. And what is Pasteur Network? I am Koussay Dellagi. I am working at Institut Pasteur as scientific advisor in the international affairs. My background is medicine. I am professor of immunology, retired, but still working at Institut Pasteur, trying to help to organize scientific collaboration between the different institutes that compose the Pasteur network. And the first slide show you. Can you show the first slide? Okay, the first slide is exactly what is the Pasteur network today. It is 33 institutes, 33 institutions which are members of the network, and these institutions are distributed over the 25 countries, 5 continents. And this very large network is today organized into sub-regional subgrouping, 6 institutes in the Americas, 7 institutes in sub-Saharan Africa, 10 institutes in Asia-Pacific region, and 10 institutes in the Euro-Mediterranean region. Next slide. And you can see here that this network, which has been created during history, because the first institute is the Institut Pasteur in Saigon, which followed just 3 years after the creation of Institut Pasteur in Paris, and 3 years later, in 1893, the creation of Institut Pasteur in Tunis, and so on and so on. And many of these institutes had been created during the period of the French Empire. In colonies, but still after the independence they remained very active, and until now almost all these countries has maintained the activities of their Institut Pasteur, and now they are members of this Pasteur network. What you can see here that today this is a consortium of independent institutions. All of these institutions are members of their national staff, and they are tightly linked to the respective national Ministry of Health, which make them a very, very potent actor at the international level and national level, with having the understanding of their respective national ministries. And what is also important is that 50 of them are public institutions and 50 of them are private foundations, and 80% are located in low and middle income countries. Today, now, the Pasteur network is coordinated by an association which was founded officially in 2022 under 1901 French law, and this legal entity, the Pasteur Network Association, is led by a board of directors, the majority of which are elected in the Pasteur Network, between the Pasteur Network members. The running of the association is under the responsibility of executive director, which is today Rebecca Gress. The next slide, you can see that despite this very large heterogeneity in structure in the statutes of these member institutes, all of them, almost all of them, has the same missions, and four main missions: biomedical research on pathogen vectors, reservoir transmission, emergence of infectious disease; public health activities for preparedness to epidemics, the outbreak investigations and diagnostics and surveillance of different infectious disease, and not only infectious disease, but also other chronic diseases in some countries; training and career development, international courses, mobility programs and career development, and in many of these institutes, but not all, innovation and technological expertise with innovative research, high-tech platforms, and biobanking and sequencing. Next slide, please. Next slide, yes. And the ambitious vision of this Pasteur network is to create the opportunity of cutting-edge research across the network and beyond. And we are engaged with major research funders to support the needs expressed by its members and the national health authorities. And this is to create the capability inside all of the institutes to run large-scale projects, and is supported by a fundraising strategy, creating a team of trained field project managers. Next slide. The scientific strategy of the Institute has been a rather late discussion that has been done during the last decade. And the question at that time was to define exactly what could be the strategy that would be behind the networking efforts. We know that each of these institutes, which is a public institution in their own country, has a responsibility, and this is their responsibility inside the country. But at the same time, we can say that we need to have a strategy to identify what are the areas that could support transnational or supranational activities of these institutes as a network, and to propose to the international community some kind of interventions that are meaningful not only at the local level, but also at the regional level, and also at the international and global level. And this thinking has been conducted during the 2010 decade, 2010 decade, and has established that this action at the international level would be directed to four priorities. One health approach for the exploration of zoonotic diseases, first. The second is devoted to vector-borne diseases and the study of vectors in the different ecosystems. The third one is dealing with something which is not infectious disease, but non-infectious disease, exploring the impact of aging and longevity on health. And the last one is mother-child health and young children health. The next slide. These four priorities there is an asset that has been identified for the Pasteur network and for establishing research programs between the different members of the Pasteur network. This is to give access to broad diversity. All these countries are established in very diverse continents, very diverse population, and very diverse environments. So it is a chance for a program established between the different countries in the different continents to have access to a broad diversity in hosts and vectors, in environments. There is a big difference in the ecology of infections, whether you are in a humid or in an arid area. the diversity of pathogens, and finally, the resources for research and development, which are established in the different countries at different levels of development. And finally, access to the diversity of populations and to have access to the study, the investigation of the the impact of genetics on the expression of disease and the natural history of infection in the population. Next slide, please. The health challenges today of the Pasteur network is listed here. We are working on viral diseases, on bacterial diseases, parasitic and fungal diseases, and you have here some examples of emblematic infections that has been targeted by the network, especially rabies. Rabies, as you may know, is probably a zoonosis that is emblematic of the creation of the Institut Pasteur itself, because of the discovery of Louis Pasteur. But since then, almost all the laboratories, the reference laboratories that has been established in the world has been led by Institut Pasteur, the local Institut Pasteur. So we think that probably rabies is one of the most important disease that can benefit from the networking organized between the Institut Pasteurs. But we have other examples of disease that we work on, among viral diseases, bacterial diseases like tuberculosis, plague. Plague in Madagascar is a very important disease. Parasitic diseases like malaria, leishmaniasis. Leishmaniasis is a very important also disease in North Africa, for instance, and Middle East, and including in sub-Saharan area in the Sahelian region. And finally, fungal disease, aspergillosis and candidosis. This is just to say that these are examples of infectious disease, but we have also some institutions which are involved in cancer research, neurological research, metabolic and cardiovascular diseases. Next slide. You can see here on this slide that the Pasteur network has already almost been associated with all the big crises of the last 2 decades or 3 decades, including the SARS-CoV-2, but also the MERS-CoV, the SARS-CoV-1, dengue epidemics, chikungunya epidemics, and Zika epidemics around the world. And so this location all around the different continents make these institutes readily mobilizable to fight against these diseases. Next slide. In the network, we have organized a body that is engaged in the thinking about the strategy of the network and following also the implementation of this strategy. This is the COSPN, what we call the Conseil d'orientation scientifique. It is a steering committee, scientific steering committee of the Pasteur network, which is composed with 12 mid-career scientists from the Pasteur network, selected by their directors and also by common discussion to have representatives of the best of the network in terms of science and mid-career science, young scientists also, and to think about the strategy of the network and to act as a consultative scientific board of Pasteur network and a forum of discussion between Pasteur network scientists. The most important aspect that is already done now by the Pasteur network, by the COSPN, is to organize brainstorming meetings on topics of interest to cross-cutting Pasteur network program. This is really probably the most important action at this time, because we need to have a proactive thinking about what can be done between the different members, the different comment dire, yes, the members of the Pasteur network, and we must have this proactive thinking, because as you know, when there is a call for proposals that is launched by funders, the time lapse that is given to propose a research program is very short now. It is less than 2 or 3 months, no more, and it is impossible actually to prepare a program between different institutions if you don't have a proactive thinking about what are the scientific questions which are relevant to the problem, and what are the action that could be undertaken in the different members of the network to collaborate on a given subject. So it is very important, and as you can see in the next slide, the next slide show that you have here 4 working groups actively working now. Emergent preparedness, which is coordinated by Rida Barbouche from Institut Pasteur in Tunis. Vector-borne diseases by Annabella Fayou, which is who is the president of the Pasteur network, but they are working on different vectors, arbovirus vectors, malaria vectors, ticks, and other vectors, and Child Health, which is coordinated by Bishra Mouin from Institut Pasteur, and also exploring wild animal reservoirs, which is coordinated by Anne Laverne in Institut Pasteur in Guyane. And you can see here that many of the projects that are coordinated by the network are also discussed regularly and presented in short seminars on ongoing Pasteur network projects, like the SARA project on antimicrobial resistance, the MATI project on leishmaniasis, and the nanobodies and envenomation, which is a project coordinated by Institut Pasteur in Tunis. Next slide. And I give you here just 2 examples of the programs that are organized in the network. And the first one is the Repair project that many of you know because they have already participated to it. It is a multi-site collaborative research program in response to coronavirus involving all African members of the Pasteur network. 10 institutes are members of this Repair program, and with 5 working packages: multicentric evaluation of diagnostic test performance, the study of molecular epidemiology of the virus, mathematical modeling of COVID-19, the study of seroepidemiology, and the investigation of the social response to the testing. This is an example of a 4 years project that had been done during the first steps of the epidemics, and which has been followed by a second program, which is called AfroScreen, which is an even more ambitious program funded by 10 million euro from Agence Française de Développement, which is still active now, and in which the 22 institutions from sub-Saharan Africa have been enrolled and have benefited from a very strong support to establish sequencing capacity for pathogen, especially for viruses, and they are now already equipped and functional in terms of human resources to conduct locally the supervision of emerging infections and the characterization of the genomes of these pathogens. Next slide. And this is another example of a very large network that has been established since so many years between North African countries and the Sahelian countries, and also the Middle East, Turkey and Georgia and so on. And the objective of this program, which is the Medilab Secure, is to prevent vector-borne diseases around the Mediterranean Sea and Saharan region by reinforcing an international network of laboratories and public health institutions. As you can see here, it's obviously very important to capacity building program, both in terms of human resources and also on material resources available in these countries. Next slide. And I think that this is the last slide, and this is innovation and technological expertise many activities are devoted to establishing the different institutions of the network of capacity of biobanking, which is so important for the future to preserve in a good condition samples, biological samples from patients and also from reservoirs and mosquitoes, and to be able to study them even years after. So the quality of conservation and stockage is very important, and hopefully the fact that these institutes are engaged in a common vision will help the exchange of material with the decision that has been taken that inside the network everything will be done as to be able to conduct all the tests and all the laboratory testing inside the country. And for that, the capacity building is a key, and human capacity building is a key element. But at the same time, the trust that is present between the different members of this network will help actually exchange material where needed when some techniques could not be established in a country or could not work in a country, so that these samples could be sent to other partners in different countries. So biobanking, biological research and big data in Paris, for instance, many of these capacities are available for the members of the network. But as an example of what has been done in terms of capacity building, very important is the fact that in Institut Pasteur in Dakar, since a few years now, they have a very strong capacity for whole genome sequencing, and has been recognized by African CDC as a regional hub for this technique. And for instance, for repair, at the time where repair has been established, we didn't have this kind of capacity of sequencing capacity in the different countries of Africa, and all these countries has accepted to send their samples to be sequenced in Institut Pasteur at Dakar. But now, by today, the different institutions has been enrolled also in AfroScreen, and they have now their own capacity to conduct whole genome sequencing on their pathogens. There is a vector pole in French Guyana that has been established, an advanced vector pole that can serve as a reference lab for all those who would like to conduct some kind of experimental studies, advanced experimental studies of infection of vectors. And finally, screening platforms for the discovery of new drugs, which are available at Institut Pasteur in Korea and Institut Pasteur in Lille. Thank you. I think that this is the last slide, I guess. Yes, and thank you for your attention. I think that probably this presentation will give you some ideas about what can be done in terms of the future of AMAX, and I am happy to see that AMAX have been created also with the mobilization of several institutes from the Pasteur network, as you know. Thank you very much.
Thank you very much, Dellagi. So I will, who would like to ask a question, have remark? Yes, no?
Thanks for the presentation, Professor Dellagi. So my question here, knowing that you are a member of Pasteur Paris, what is the role of modeling in decision making in Pasteur Paris, and how can Pasteur Network support in capacity building in mathematical modeling in Africa?
Okay. Thank you very much. In terms of use of mathematical modeling to run actions against epidemics, I think that the COVID-19 was a very important step to demonstrate the importance of this. And the group of Institut Pasteur of mathematical modeling was very active during the epidemics in France. And the mathematical modeling was performed in a very large part at Institut Pasteur. What we want to do now is that this capacity should be enlarged to all the network, and to develop this human capacity and to train people to manage the modeling. And for this, I think it could be discussed later, but what I have proposed to Slimane is to create a group of reflection within the COS-PN, within the steering committee of the PN, to see exactly what would be the conditions to organize some kind of common structure in modeling, and to identify what are the needs in terms of training. I think it's feasible. I think that Slimane and also you, Amira, and also all those in the AMAX group would be the leaders in terms of thinking by participating to what could be organized by the steering committee of the COS-PN. And if so, the question will be what are the needs? What are the possibilities? What are the institutes which are interested in participating to this network? To have an inventory of the resources that could be mobilized in the 33 institutes, and what could be the leaders, and what could be the students, and what could be the trainees, and what could be the trainees. And so once you have done this kind of inventory of the resources available and also of the needs, you can propose also within the COS-PN a strategy to develop these resources. I think it's probably something feasible. It is something which is timely now, and it is something where Institut Pasteur in Paris could play a role, but not a central role, but just as a driver of transmission of the knowledge and the know-how. Thank you.
Thank you very much, Dellagi, because you make also the transition from your talk and the roundtable that we're going to have now. So I will, if someone would like to add something, to remark, Cheikh Loucoubar, yeah.
Thank you, Professor Dellagi, for the presentation. Cheikh Loucoubar from Institut Pasteur of Dakar. So my question or remark is, like for the Pasteur network, have you some reflection on how to support modelers in communicating with decision makers? Because in general, we know that modelers are very technical, and decision makers in general are people on policy and in general without mathematical background. And sometimes it's hard for politicians and modelers to be on the same table and understand each other. So I know that WHO Afro, with the support of Gates Foundation, is putting in place these kind of national centers in some countries, trying to help scientists to make policy brief, like instead of a scientific paper, writing something in 2 pages that can summarize the evidence and then put that on the table of policymakers. Have you some effort or reflection on that? Thank you.
Yeah, thank you, Cheikh. Your institute is one probably of the most active now, and I am very happy to see that so many progress has been done in different structures, including in mathematical modeling under your supervision. So what can be done to help the interaction between modelers and policymakers? You can say that the Institut Pasteur network is probably the best way, and the Institut Pasteur institutions as institutions, as national institutions, are probably the best to help establish this dialogue. Why? Because simply, historically, the institution which has been in all these countries responsible for fighting against infectious disease have been the Institut Pasteur. So where an Institut Pasteur is present in a country, it's probably the most important institution to discuss with the Ministry of Health, and they have the ear of their their policymakers. And so I think that if a network of mathematical modeling is established inside the Institut Pasteur, they will be in a tight contact with the health problems as they are treated in the real life by the institution and also by the public health institutions of the country and the Ministry of Health. And so I think that when you put your reflection not only on the ground of conducting research and publishing papers, but also on putting the question of what can be bring as information to the Ministry of Health to improve the capacity of this ministry to tackle an infection risk or an emerging risk, in this case, you will be probably listed. And so I think that even if collaboration outside the network is also crucial and very important, like what you are doing with AMAX, but I think that inside the network, you will have some kind of facilitation of your discussions and your interactions with the Ministry of Health. I think that I recommend really to create this group of promoting the mathematical modeling inside Pasteur Network, and will probably bring new information to the decision makers inside your institution, so they can put it as a priority now to manage, like exactly social and health sciences. For instance, the same thing has been discussed with the development of social and social sciences in support to the management of diseases. We have been very weak in the Institut Pasteur network with the social sciences, and now they have considered that really it should be established as a network inside the Pasteur network. And so make the thing like exactly for social and economic sciences, and you will be successful, I think.
Thank you, Professor Dellagi. Totally agree with you.
You would like to ask a question?
Good morning, Professor Dellagi. I'm Cheikh from Institute Pasteur of Tunis. I would like to ask, maybe the event is more focusing today on pathogens and vaccines and modeling, but I would like to benefit from this opportunity to ask, how is the strategic in Pasteur network toward modeling and non-communicable diseases? So for cancer, for precision medicine, for genomics, and human medicine or human genomic medicine for non-communicable diseases, do we integrate or consider also sustaining decision makers, public health, and type of diseases as cancer, not necessarily related to pathogens, in the strategic consideration of Pasteur network? Thank you.
Yeah. Okay, thank you for the question. As I said, I think that doing science is important, is very important. But doing science, a meaningful science that would be used to improve the health of population, is more important. So I would say that a science without a contact, a natural contact between the scientists and also the policy makers and the decision makers is a waste of efforts. It's very important to be from the beginning, having in mind from the beginning that what you are doing in terms of research or fundamental research, even in fundamental research, could be translated into practice and into improvement of the health of population. I am absolutely convinced that without doing this, we are in low and middle income countries, and each euro is important, and you have to use it to have an impact on the health of population, which is very clear. As far as as you put the question on genetics and non-infectious diseases, I would say that the epidemiologic transition is already in action in our countries. All our countries are facing the problem of epidemiologic transition, and so the non-infectious diseases are more and more important, and the Institut Pasteur must be involved in research and public health linked to these questions. As you know, cancer is a crucial problem. And cancer has been one of the most evident application of the precision medicine approach. And you are surely know surely that we have a program in the Pasteur network between the three Institut Pasteur in Tunisia, Algeria, and Morocco, which is ongoing. The so-called PERMEDINA project, which aim is to identify what are the key elements to be taken by the Ministry of Health to allow implementation of precision medicine in these countries. Precision medicine is very special. It's a paradigm which is completely different from the classic way to conduct medicine in the different countries, because you need absolutely to have a strong interaction between genomic investigations and clinical studies and histopathological information of the tumors. If you don't have this kind of holistic view of the tumor, you don't be able to propose the very costly new therapeutics that are so active. And so to establish this paradigm, this new paradigm, the PERMEDINA project has been established and has taken as an example, a demonstrative example, the case of lung cancer in North African countries, and try to identify what are the genomic factors that are associated with this cancer in the region. But you can do it the same thing with many other cancers, like breast cancer, like cervical cancer in women, etc., etc. So I think that there is a place for establishing also programs against these non-infectious diseases. As you know, also as an example of the link between genetic diseases, human populations, and specific risk, you have the immune deficiencies, the congenital immune deficiencies, which are so particularly frequent in our regions, in North African and in Middle East region, because of the classic of the endogamous marriage is very high in the region, so recessive diseases are more frequent in terms of homozygosity and homozygous diseases in the region. So we have a program in Pasteur Network, which is established between Institut Pasteur, with Institut Pasteur in Tunisia and also European countries, to develop the investigation of these immune deficiencies, congenital immune deficiencies, and to promote the mechanism by which consanguinity could be decreased in the region by acting on by information and acting on social factors that have allowed this kind of marriage to be established in our region. Thank you.
I have a question to ask you. How do you imagine that we can enlarge the network in other other institutes who do not belong to Pasteur Institute, like CEMA, like in Uganda, where you have very good teams of modeling and interaction with policymakers. But they do not belong to Pasteur Network. And it's very interesting for us to enlarge the scope of taking all the persons who can work with policymaker and modeling in Africa in order to make a unique group and exchanging knowledge, exchanging techniques, and exchanging scientific questions.
Slimane, my advocacy for Pasteur Network should not be understood as to push you to work only within the network. It is very important for you to work also with institutions outside the Pasteur Network. This is crucial for competitiveness in terms of access to funds with funders. Consanguinity is never a good thing. And the consanguinity between the Pasteur Network by excluding other institutions from outside is not a good thing. And the second thing is that the network is the Pasteur Network is almost in 80% francophone, and I think that it's very important to maintain the contact and the openness to institutions from countries where English is the native language. And so your actions in AMAX is really important, and the fact that Uganda, Kenya, and also other countries could be associated to your efforts is very crucial for the meaningless the meaninglessness of your efforts. Now, what do you have to do to enlarge the network? I think that the first of all is information. You should make your AMAX, you should promote the information on AMAX inside the network. And for this, you have the COSPN, where you can propose or present a lecture to make the 12 scientists, members of the COSPN, informed on AMAX and discuss with them on how to enlarge the enrollment of other institutions from the Pasteur Network. The second step after this information is to conduct what I have proposed earlier, to conduct an inventory of the institutions. We have 33 institutions, but all of them are not interested in modeling, perhaps. And if you identify those who are really wanting to or willing to develop this capacity, you have to perform this kind of inventory and identify these institutions and their resources that they can put in the efforts. Once you have this, and then you have to organize some kind of meeting to identify what could be the priority of this network of mathematical modeling, and select 2 or 3 that could be emblematic of what you want to do in terms of training, in terms of exchange, exactly what we have done also with AMAX, and the fact that many of your colleagues are now training PhD students. This is the future, and this you have to do it on a larger scale within the Pasteur Network. It is feasible, I think, and we can discuss together if you want with the AMAX group to see exactly how to transform this into action.
Thank you very much. Who would like to add? Yeah? No? Who? Okay, I will stop here. Thank you very much, Koussay. And we'll have a short coffee break. And then what we are suggesting, you have then a meeting to discussion in order to see what we need to do, what we have to do, and what we will do on the project. Thank you very much. Thank you. Thank you. So the question is, how can you extend what you are doing to AMAX is only 3 years, and eventually 3.5 years. But the question, how can you extend what you are doing now, to the after AMAX? What are the possibilities? And I would like to have your point of view. Just brainstorming what you think. I will give you one possibilities.
I think first we need to find a way to have money. How can we have additional money? Is the key question.
Yeah. Go on. Thumbi. Yeah.
I think, first of all, you need to construct a consortium, a real consortium. After, you can go to find the money, but I think first of all, you need to construct a consortium. Yes.
Create a consortium.
Yes.
The idea, yeah?
I think money and consortium, even consortium does require money to some extent, right? But in my visiting, the very short visit I've had here, I feel like there's such a network of people that already, whether they have money or not, this is what they want to do. Yeah. So even if we developed a loose connection among ourselves that can be maintained by the desire to be involved in policy modeling, then we'll find opportunities for money. I feel like money comes after identifying people. And I feel like through these AMAX, you already have such a network of people that if you found ways of connecting them more very cheaply, whether it is through a monthly or bi-monthly meeting or just presenting your work among ourselves, you already create a knowledge among ourselves that whenever there's an opportunity to look for money, you have sort of already glued together as potential partners.
J'adhère à l'idée donc de la création du consortium, mais il faut aussi surtout, après ce consortium, faire beaucoup de formation, de sensibilisation pour se faire connaître d'abord et aller donc aux appels à projets pour pouvoir donc réaliser des recherches ensemble. En fait, je disais, il faut accentuer aussi la formation et la sensibilisation. Après la création du consortium, il faut faire beaucoup de formation, beaucoup de sensibilisation, non seulement pour avoir une grande équipe de modélisateurs dans tous les pays du consortium. Et là, les gens pourront faire donc répondre aux appels à projets et c'est ça qui va entraîner la visibilité donc, du consortium.
For the consortium, you have the proposition of Dellagi, who said that inside Pasteur network and Pasteur network and neighborhood, begin to think about the creation of this network, modeling network inside ours. I mean Africa, but not all, but not only Africa. Do you think that you can move on this direction? Yeah.
I think inside the Pasteur network, you already have a Pasteur international unit. Pasteur network can support the creation of Pasteur International Unit.
But I understand, not only.
No, for Pasteur International Unit, Pasteur International Unit is not only for the member of the Pasteur network. You can extend to other institutions. But what can I say?
Say in French.
Est-ce que les autres institutions qui ne sont pas du Pasteur Network peuvent être dans une unité internationale qu'on appelle unité internationale Pasteur? Parce que c'est le problème, c'est le nom.
C'est
le nom de l'unité. Parce que c'est un outil du Pasteur Network, le Pasteur International Units. If you want to, si on veut créer un Pasteur International Unit, on doit forcément mettre Pasteur.
Well, if I understand, in Pasteur you have two levels. The first level is what they call a network. The same thing that our colleague from human science, they create. And this one can be Pasteur and the neighborhood, other person. Second things can be, you have a core concerning what you said, laboratoire international, which can be also a solution. But as you said, you need to have a Pasteur name. Yeah. Other ideas? No idea. Yeah.
I wanted to reference to some that we might have to think about. We have a few modeling networks already on the continent that I think have been funded, particularly by the Gates Foundation and a little bit of the Wellcome Trust. I know like a malaria one, there are possibly upcoming ones for neglected tropical diseases. And the last grand challenge that was put together by Gates and Wellcome Trust is just about to make the funding decisions. And as part of it, they will try and create another big network of modelers on the continent. Yeah. So you might have to think, how do we develop ourselves so as we are part of like that bigger network that already will have money, and maybe some people here are already part of those networks that will be funded. Like, so as it's not a duplication, but it's more of it's adding value.
Voilà, c'était pour dire que le problème pour pouvoir vraiment continuer dans ça, donc on a eu une chance d'avoir un financement pour travailler pendant 3 ans ensemble. C'est une chance. Et c'est en fonction de ce qu'on va faire durant ces 3 ans aussi qui va déterminer le futur. Il y a 2 volets. Un volet, je rejoins un peu Thumbi par là, c'est-à-dire que si on a de la volonté, et que la confiance est là et la motivation, on peut continuer à travailler avec vraiment peu de ressources en respectant un calendrier où on se rencontre, on échange. On sait que c'est difficile, hein? Chacun est très surchargé, voilà, chargé au moins quoi, quand on retourne dans nos institutions. Mais si on fait l'effort de faire des rencontres chaque 2 mois ou chaque 1 mois, et en fonction de ce qu'on va produire, c'est ça qui va nous permettre, qui va convaincre celui-même qui nous avait donné de l'argent, s'il voit de l'utilité, à continuer à nous donner des fonds, des choses comme ça. Mais vraiment, c'est l'impact que nous aurons démontré qui nous permettra automatiquement, après les 3 ans, de continuer. Si on n'a pas ça automatiquement, au moins le laps de temps entre les deux, la motivation nous permettra de rester connectés et de continuer à travailler.
I can translate. Okay.
Yeah, I was saying that we have a chance. This is a chance to have funds to work for 3 years together, and we have to, it's the occasion for us to demonstrate that what we are doing is useful for our country, we have to demonstrate that during this, so we have to work on that. And also I agree with you saying that if we are motivated and want to work together without limited resource, we can keep discussing online like every 2 months, this kind of thing. Even if we don't have automatically additional fund after the 3 years to keep the team together. It's very hard to do that because people are very busy when they go back to their institution, but we have to be focused and determined to do that. But we have to demonstrate during these 3 years to show to our funder, Bill and Melinda Gates, that what we are doing is useful for our governments, for our population.
Yeah, these are my few thoughts. One, we have to start to think about progress from now. We don't have to wait for the 3 years to end to continue. So we need to identify opportunities even now where we can get resources to continue our work, because the 3 years is like bringing us together, and then we have to think about how we shall go further. So we need to be looking out for other sources of funding that could be available that we can work together with. Number two, it's the quality of the work, as my friend from Senegal here has said, that we are going to produce from what we have been given. Because this is a test for all of us. If this that we have been given does not produce good outputs, then there's no reason to continue. So from the different countries where we come from, the different diseases, we need to ensure that we get good outputs so that these outputs now sell us even to the next level. Thank you.
Moi, d'après cette école et ce qu'on a fait pendant l'école, je ne m'inquiète absolument pas pour la suite du travail parce qu'il y a des facteurs de production, des vecteurs de production importants qui sont les étudiants. Donc il y a des sujets de doctorants, il y a des sujets de postdoc. C'est là-dessus qu'on doit s'appuyer, c'est eux qui en fait vont faire le lien et le suivi du projet. Donc à partir de leur travail, il y aura la production et puis un travail commun, il me semble. Do you have to translate? Oh no. Okay, just to what is success? What is the factor of success is the student and the subject, research subject of student, and this is can be the power of this project, and because there are a vector of production.
Bon, moi je pense que après AMAX ne posera pas de problème si les conditions dans lesquelles nous sommes en train de travailler seront revenues. Parce que y a un adage qui dit, si tu veux l'argent, crée les conditions de l'argent va venir lui-même. C'est-à-dire qu'à partir de ce qu'on est en train de faire, si on se donne de confiance entre nous, comme disait Loucoubar, il y a un travail sérieux, il y a la volonté, les compétences, il y a du sérieux. Ce qui est sûr, l'argent va venir à travers les projets. Donc, moi, je proposais qu'on puisse, comme disait Jules, on crée le consortium et dans ce consortium, il y a des compétences, il y a du travail sérieux, les résultats sont là. Pour l'argent, on en aura forcément. Donc, Commençons d'abord à créer les bonnes conditions de collaboration entre nous, avec de confiance, du travail sérieux, de cette dynamique, des résultats qui à la suite de ce projet. Les gens vont regarder et dès que il y a du confiance, il y a du sérieux, les gens peuvent nous dire que non, il y a l'argent, est-ce que vous pouvez faire telle recherche, et ainsi de suite. Donc, commençons à créer les conditions, le reste, on verra. Merci.
I'm a little bit late, so maybe I missed many things in your talk. Maybe I'm repeating some ideas. So I think that, as Brice said, funding will come, but we need to work and believe on our ideas, which means that we need to develop questions in regard to real disease and real problem for each country. It's not just about taking the opportunity, it's more than that. We need to create models that really works for specific disease and for specific countries. I don't know if you heard Slimane. So, yes, it is the consortium, but more than that, we need really to talk about which are the important subjects of each country. Like, for example, from this, the discussion of today, I think that for Niger, it will be great if we can develop a sub-project around meningitis, because I think that from Slimane, I also heard that there is a real problem in your country around that. And if we can get more funding around this subject to be able to really to produce models that can really help and matters for each country, I don't know, what do you think about that? Maybe we need to make a reflection, thinking about how we can really help. It's not just about HPV or COVID-19. No, it's not about that. It's more than that. It's real models for real problems. If we believe on our problem and that we can give solution, then certainly we will succeed, because it's important for us.
Just to complete what Amirai said, we can achieve this through creating management committee meetings. I just take an example from H2A Bayonet. What they do is they create little network for PIs, or key person in each countries, and then they bring questions regarding their problems, sanitary problems they have in their country, and then we can build a big topics around that, and we are trying thinking how to do it, and then we can have regular meetings. The frequency we can discuss each 2 months or 3 months, and after we can, this is little bit step by step we can achieve this. So I think first of all we need to create a little committee management meeting for that.
En fait, je dirais par rapport au consortium, il faut surtout que ça soit uniquement des modélisateurs. Il faut associer aussi les autorités, les politiciens, pour qu'ils puissent savoir de quoi, quelle est l'importance de cette modélisation, qu'est-ce que ça peut apporter. Dès le départ, donc, il faut surtout impliquer le politicien aussi dans le consortium.
How would I say that this type of consortium should integrate policymaker? And the question that I have, which policymaker should be integrated in the consortium? Are they in the core of the consortium? And is the Ministry of Health? The notion of policymaker is very. Yeah, exactly. You have a large range of policymakers. It goes from the Ministry of Health to the medical doctor who works on the disease that you are doing. And one of the questions that I ask myself, which where do we stop? La question que je me pose, c'est la suivante. La notion de décideur politique est très large. Ça va du ministre de la Santé jusqu'au médecin qui va travailler sur la pathologie, etc. Et chacun a un intérêt différent. L'intérêt du médecin est de soigner, l'intérêt du politicien est de faire la politique. Donc, quand on parle d'intégration, qui en intègre et comment? Ça, tu vois ce que je veux dire?
En fait, quand je parle des politiciens, il y a des directions. Quand vous prenez dans nos pays, il y a des directions de surveillance, de riposte aux épidémies, par exemple, quand on les prend. Au temps de la COVID-19, c'est eux qui ont servi de lien entre le ministère et la recherche. Donc, il y a des directions cibles qui peuvent intégrer le consortium. Les directions de surveillance, les directions de l'immunisation par rapport à la vaccination, les directions de la santé de la mère et de l'enfant, c'est ces directions qu'il faut inclure parce que c'est eux qui partent vers le ministère de la Santé. Mais si on reste seulement entre nous, ça va être donc un consortium de chercheurs où on va faire des travaux publiés et puis ça va s'arrêter là.
Thank you.
Je peux intervenir?
Oui, professeur Koussay, tu as la main.
Oui, ok. Yes, the discussion is interesting as with the involvement in the consortium of public health the decision makers. I agree with what has been said very recently, saying that the most important thing is not to have a politician. The most important thing is to have the ruler of the national program that you are dealing with. So you need to ask for those who are in charge of epidemiology, of preparedness to epidemics, of management of epidemics to be part of your consortium and to understand exactly what could be brought by modeling in terms of action, practical action on the field. So I think it's relatively simple. You don't need to have politicians, but you need to have technicians and central technicians. Those are working in the Ministry of Health and in other agencies in charge of health. The second point I would like to stress is that the future of AMAX is in the results of AMAX. It has been already said that if you are successful on what you have proposed to do during the 3 years of AMAX, you will probably convince the funders to continue to support you. So I think that instead of looking very far, look for what you can do actually to make your proposal successful and reach the result that you have decided. So I think that money will come as long as you will successful in your actions. Money will disappear completely if after one project you didn't get readable and applicable results, and in the future you have to take care really of this problem. You have PhD students which must do not only PhDs and scientific results and bring scientific results, but also take care of presenting these results as a part of the solution for the control of infectious disease in your countries. Thank you.
Yes, it's true, but also we must be careful about the fact that a success is also, how to say this, supports the student even after finishing their PhD, which mean finding a way to get a position for them or open. That's all. Finding, which means that you should not lose them. Usually they will certainly leave the country after getting the position, after getting their PhD, so we must be able at some point with sustainability keep them in our countries. I don't know how we will do that. Do you have any recommendation how we can do that?
It's very difficult to respond to this. It's very difficult. And I think that it should not be the central part of your reflection because it's a critical problem in all the countries to have recruitment and stable recruitment of scientists and young scientists in the institution. I think that the key of success is probably to demonstrate that mathematical modeling is really a part of the solutions. And if you are successful in proving it, then recruitment of modelizers would be something new, but at the same time would be successfully established in your institutions. But it's very hard to say how to do it because it's a problem of resources, it's a problem of frequently competition between different specialties in having a final position in an institution, like an Institut Pasteur, for instance. You can't say, I will recruit you. You have to compete to be recruited and to compete with other specialties like virology, like bacteriology, like and so on. Thank you.
Yes, thank you. Adding to Amira's comment for PhD students, I think to help these PhD students for their future, it can be for themselves to develop their career. It's during these 3 years, for example, if we collaborate with some universities that are outside the consortium, it can be American universities or Asian universities, European universities. In the work that we are doing with them, they can trust us and they will be willing to receive our PhD students for a postdoc, for example, after their PhD. If they know the good level, the scientific consistency of what we are doing, they will be happy to receive them. And it's a good opportunity for them because it's also an enrichment for the student to go outside his lab after the PhD, to do a postdoc outside, not like always trying to keep them with us, but it's good if they go for 2-3 years outside and come back, because when they will come back, they will have a diversity of vision, additional skills, and even they can have capacity to bring money because they have new collaborators and they are exposed at international level. If they have this aim and this willing to come back to their country and to serve their population, the Ministry of Health, this also is something to discuss with students. Thank you.
Thank you. I wanted to try and respond to part of your question because you have thought about this quite carefully. It's very hard for people to come back to places that don't exist. Like, I think people who are way ahead in their careers, Slimane here, Cheikh, and others, we have to work really hard to create institutions within wherever we work that can accommodate and take in people as they graduate. I am in full agreement. Exposure is great. Let's go to Europe. Let's go to America. All the people I studied with at master's level that went to Canada never came back. They got their citizenships immediately. It's a real thing for Africa. How do we ensure that somebody can actually live a comfortable life here, because you have to meet your bills, where solving the big issues that our continent have got? It must be institutionalizing these things. So unless if we move our minds from a single project to another project to create institutions within our countries that can competitively get the best of minds and make them comfortable within our countries, then I think we have a way forward. Otherwise, the economics of life will be that your best trained AMAX fellows will be elsewhere.
You have two things. You have the first one is creating condition in our lab, in our institution, in order to bring students and to allow students to stay there. Second thing is what happened in our countries. What happened in our countries can be different countries, different situation, and something that you cannot act on it. It's something that it's a constraint that allow us to work. However, what we can do, it's what happened in our structure. What happened enabling students to stay there, and if you enable them to stay there in a good condition, in the, I would say, the same condition that we'll find in Europe or the United States, perhaps they will stay there after the student life, after the postdoc. So the question is how to do it. How to make the environment a good environment for them to work. AMAX is, the goal of AMAX is this one, is creating a place, creating situation, creating environment in order to allow students to work exactly in the same place that they will find in US or in Europe. We choose the lab that you know, the institution that you know, because you know them, you know that you have a capacity and they can grow in order to a level that we can find it in other place. What we have here, and it seems to me that in other countries, in European countries that do not have, we have the problems, and you have the constraint. It's not, I mean, it's an illusion to say that we can do science and we can working and with policy maker in the exactly same way that we work in Europe. If you are in Africa, we have constraints in Africa, which can be helpful, but also can be, you have good things or you can have bad things. For example, the Minister of Health in Tunisia, I can meet him. It's easy for me to meet the Minister of Health. I don't think I would be in the same situation if I would be in France or in whatever, in other countries. So you have some proximity with policymakers that allow us, but in the same times, I do not have access to the data. I have no data to work. I have a lot of things that I cannot have. So the goal of AMAX is this. I would like to have your point of view of the following question. So I totally agree with you on the fact that our success at AMAX will allow us to continue or not. So the question that we have a lot of call for creating networks, creating mainly from Bill and Melinda Gates Foundation. Do you think it's suitable that one of us can, with the same consortium, apply for another call on modeling in Africa or just waiting until the end of the process of this project in order to apply to a new call? I don't know which is the best. Knowing if you apply to another call, you have more work, more, I don't know. I don't know what is your point of view. You will have more money, more work, and you will need to do both of them in perfect way. I saw, I mean, 2 months ago, a call from Bill and Melinda Gates asking for modeling consortium in Africa. And at that time, I think, well, do we have to apply to this call, or just to let him go and just waiting for the next time?
Yes, I think in general, what I saw in general is the same consortium to apply again just before the end of the consortium, like after the midterm, like 1 year before the end, show to the same founder or as a founder that we are the same consortium at least. Maybe we can have an additional partners depending on the future objectives. We are applying to have more money to keep things sustainable or to extend to something that is coherent. And inside, we can change maybe the PI. It can be someone else within the consortium because you have experience. You show that it's feasible and it's useful. As Professor Dellagi said at the beginning, in this type of funding, we have to focus on how to do the job very well. First, at least from now to the middle of the 3 year, we have to put our effort and our brain in how to do this in the best way. If we cannot do it in the perfect way, at least in the best way, and this will be very fundamental. But I don't think that one of us can at this time try to submit a project and then have it in additional. And it should be duplication of efforts. They prefer the same consortium have another round, a second round or a third round. Thank you.
I think it's also true that if you want anything done, you give it to the busiest people. There's a reason they are busy, maybe because they deliver. And in thinking about like those new calls, I know a number of people that applied for like the grand challenge that Wellcome Trust and Bill and Melinda Gates put forward, and many of them have actually money, like AMAX. Yeah, it's more whether you can convince, whether you're expanding your work. Because as you can tell right now, even with AMAX, you possibly will struggle with the amount of money you have given the needs you have. You have more need than there is money for. So the more you develop the network, the more you find people that you ask to be part of your network and you don't have money for them, the greater the need. And if we can deliver, I think there's no limit to the amount of money that we should be able to bring back to the continent that comes from the funders. The biggest part I feel like we would need to consider quite carefully as AMAX is that what we are proposing is a technical field. So we should make an appropriate investment in developing our technical ability to be good modelers. Because if we have our technical ability, then we can address most of the questions that are ahead of us. So maybe as part of AMAX, we should sort of, besides the meeting you've had now, how do you keep the technical growth of, say, Niger to be closer to what you've got in Tunisia and support each other so as we can grow a network that is really strong and addressing, like you said, real issues that are pertinent to our continent.
So, question?
Student, do you have any comments? Certainly there is a lot. Enas? No? Weird. Okay. Can I ask you a question then? Yeah, all of you, students. Who? Joel, you want to say something? Okay.
I wanted to say something on what Slimane said. There is a new call. Do we apply or don't we apply? My answer would be simple. We apply, because even now we have seen needs like the one in Niger for the meningitis. That's a need. Even as we discussed among ourselves in the last 2 weeks, so many things came up and they all need more money. So I would think that if there is a possibility of writing, I mean, you will lose nothing, you know. If you don't write, you lose everything. If you write, you lose the ink and the time. So I would think that we can look among ourselves and write, because even we have very good students, but we can't take them on because we have little money. So I would think that, this is my personal opinion, it would not hurt to give a go if the funder accepts, because sometimes the funder will say, you still have some work you haven't finished. So it would be nice to talk to the funder and say, we've seen this call from you. These are the objectives we put forward for AMAX. And you see, AMAX was a bit limiting. It's talking about women's diseases. So what about the men? Okay. Yes, that's why I'm saying. No. I'm saying, yeah, as AMAX, we have seen it's only for, you are talking about, okay, it's about equity in women, yes. So our argument would be, we want to expand beyond just this AMAX story. We have other capacity to build in modeling for other diseases. And also, even under AMAX, the money was little, so if we got more money, we could actually do a better job. You know, we've had a workshop and a training for 2 months, and we've identified very nice questions for which we don't have money. So that could be an argument put forward to the funder, and then see what they tell us. Because many times, if you have a relationship with a funder, you talk. You know, you are not like somebody who doesn't know who is there. And then, depending on the answer you get from them, then you can go ahead and write an application.
En fait, moi, je voudrais intervenir par rapport aux pathologies qui sont prioritaires dans nos pays, surtout en Afrique de l'Ouest. Si je parle de ces pathologies, ce n'est pas uniquement au Niger, c'est le cas du Sénégal et des autres pays. Nous avons le paludisme, malaria, qui constitue un problème où il y a des milliers de cas, voire des dizaines de décès par an. Il y a les méningites, il y a la malnutrition, il y a la rougeole qui revient de manière épidémique qui est cyclique. Il y a eu la vaccination, mais ces derniers temps, on observe beaucoup de cas. Donc c'est pour dire que c'est là où la modélisation a sa place. Pour dire que par rapport à ces pathologies, il y a des stratégies qui sont adoptées, des stratégies, donc plusieurs stratégies pour lutter contre ces pathologies ont été mises en place par le ministère de la Santé. Ça fait des dizaines, voire des vingtaines d'années. Mais jusqu'à présent, ces pathologies donc, sont cause de décès dans nos pays. Donc, si la modélisation peut intervenir pour voir quel modèle, qu'est-ce qu'il faut faire pour prédire donc la survenue de ces pathologies qui reviennent de manière cyclique. Ça veut dire que c'est lié au temps. Il y a d'autres qu'on voit plus pendant la saison sèche, d'autres pendant la saison froide. Donc c'est lié au climat et à l'environnement.
Yeah, still answering to Slimane. One of the challenges we have found from the AMR side is that the data we have may not be enough to answer all the questions that we have. So if we got money that can help us collect prospective data for even 2 years, it would help us to improve the models that we are making.
Yeah, we have our first quarter meeting at the end of this month. So maybe we need to prepare really for this meeting and find a way to ask them about possible more funding for collecting data, but for AMAX we are not allowed. This was the condition at the moment of submitting the proposal. So I know that AMAX, they will not accept that the budget will be used for generating more data, but we lose nothing if we, yes. Yeah. Certainly, yes. What do you think, Iman? We can ask that during the first quarter meeting.
To have additional fund for collecting data, I think, well,
not to have additional fund,
yeah,
but ask about if there is any kind of funding that can be complementary.
Yeah. Well, I don't know. I really don't know the answer. The main, I will give you my point of view. You have modeling. You have also biological question or work that will generate data, and modeling use data. So mainly, generally you have in many projects there is separation between who generate the data and who use the data. There is some pluridisciplinary project where you can do both of them. And so the question is where to apply. And be very careful, not applying. I mean, if you, as Emira said, AMAX is for using data, it's not for generating data. Trying to find perhaps other projects, pluridisciplinary project, where you have both of them. Or even only generating data project that will generate data with the methodology and so on. Dellagi, yeah?
I add information about this very important point, how to generate and when to generate new data in support of mathematical modeling projects. I think that generating data is very costly. It's very costful. And you should much more be successful if you try to converge your own projects with those who are trying to generate data in the field. So you must work with epidemiologists. You must be part of the discussion that precede the decision of launching a project on the field. And so you can ask for shaping the project exactly as you need to feed your programs. But at the same time, you should know that generating data is a problem of confidence between the partners. And you already have discussed this point that in Tunisia, for instance, you have had some difficulties to have access to data. And this is why I say that as soon as you will involve in your projects, in your consortia, partners from different specialties, like for instance virologists, if you want to have data on virology, or bacteriologists if you work on antimicrobial resistance, etc., you have to involve them directly in your consortium and participate to the discussion. I think it's absolutely crucial. Now, back to the question of do you need to submit new projects while doing this one? I think it's a problem of rational and logic. If you are relatively confident that the objective that you have already put on the first project, AMAX, will be met, and that you have enough confidence on what you will give back to the funders as a report, in this case, you should, 1 year before the end of the project, think really as a group to participate to other call of proposals. But the problem is not to go separately, because if you go separately, will be less convincing. You will not convince on the capacities of a simple group, but if you work together, you will be more convincible to the funders. So I think that maintain the strength of the group, maintain your willingness to work together, maintain the fact that once AMAX will be successful, you will be more successful even for the next call of proposal, and you will have not only 500,000 euro, for instance, but perhaps 3 or more money will be available. And at the same time, try to involve in your projects epidemiologists and also virologists and microbiologists and so on, and decision makers at the Ministry of Health, are the leaders for the programs at the Ministry of Health, so that you can make them sensitive to the needs of your programs. The last remark is with regard to malaria. Malaria is a very, very important step now with the introduction of vaccination against malaria, and many of your countries will probably be invited by WHO to introduce also the use of vaccine against malaria. But as you know, the epidemiological situation are completely different between seasonal malaria, humid parts and less humid parts, etc. And so modelization will be very important to take part to these programs of vaccination. So since now I know that in Niger, for instance, you are preparing for the introduction of vaccination. So please be part of the discussions and put your group as a provider of information and useful information for the future and for the analysis of the results and the shaping of the vaccination program. Thank you.
So I would express, first of all, my motivation and also my pleasure to be part of the AMAX group. Maybe as a PhD student, I have 2 questions. First, for example, how we will organize our work. Maybe it will be organized by each team disease. And the second question is how we can provide the monitoring effectiveness of the results of our project. For example, it can be measured, for example, by the number of publications or how the results provided in the papers are applied by policymakers. Thank you.
So anyone want to give an answer to Umayma?
I said publication first, and after we can, extend discussion with policymakers.
The indicators for us are you, and that you finish your PhD, and also publication. And of course, how many models really were used for this issue. All what you said is correct. Then the first question was what? According to AMAX school, this is what you are. If you want to work and keep working together as a group, I know that you enjoyed that, please do it. It's okay. But as a PhD, it's your own project, so we need to develop really questions that only relative to you, but however you can, if you have new ideas, if you want to work with the team that you worked with during the school, please continue. We will give you all the support for that, and if you need help, we are with you, of course.
Just to add something. The goal of the school was to create a cohort. Cohort and subject, 2 things. What do you mean by a cohort? It's not only you. It is all the students who was in the school. I mean, you are groups. You create groups by disease in order to allow you to continue to work together. And also in order to, and you know, I mean, we present you teacher with specialties in order to have access to them. If you have any question, you can ask them. If you have anything that you need, you can ask them. Of course, if you have PhD student, you have supervisor, who the supervisor will follow you. But not only. If you have different question to different person. For example, if you would like to make a multi-agent model, you know who ask. If you want to make economical aspect, you know who to ask, and so on. So what it seems to me, what is very important is this notion of groups moving together during 3 years. The groups you have AMAX groups, but you have, like I said, neighborhood of AMAX groups. Is all the person with whom you work. And what we'll try to do in the next is to try to preserve this cohort, even if you are not in AMAX. Because AMAX, what is it AMAX exactly? It's a PhD grant and school. And travel, PhD, plane travel in order to move from one country to the other. These three things. So you can imagine that in your groups you have students paid by another project. And AMAX allow them to go to the school within another country. Can be good. I mean, it's type of what I call neighborhood of AMAX, or type of interaction that we can create between the element of your group. Okay? Other question? Okay, so I will stop here. Just before finishing, what I will suggest to do. I will begin to write a draft of what we said now. Just I would say, I don't know how you call it, but it will be a draft of the main discussion that we have, the main conclusion that we have. Please, it will be a shared draft. So please add all the part that you would like to add. It's just, like say, a brainstorming and let's say, a resume of the discussion that we have. And so add what you want, and then it can be interesting to then, once the draft it's going to be more structured, to share this draft with other colleagues from outside us, mainly Gates Foundation, Pasteur Network, and a certain number of groups that will help us after the finishing of AMAX to allow us to continue and to have other grants. It's okay? Yeah.
I wanted to ask a practical question. Now that we have like a PhD student at the Imperial Nairobi, who hasn't made it to this summer school, how does she regularly interact with the rest of the cohort, besides when they meet every once a year? The reason I ask that is that I imagine practically to foster collaborations between, Senegal, Kenya, Tunisia, I don't think it's possible to do it effectively if you only meet once a year. Is it possible to consider an effective way of having technical exchanges, whether it's a student every month or two of them that present what their model is doing like, or asking a question, or me, can make presentation of the work that you're doing, so as you foster that kind of routine communication, in the absence of which we'll only talk when we are planning our ticketing to come to the next summer school.
Certainly, in fact, we were doing this starting from September. We are having two meetings per month. It was more about technical things around the project AMAX, how we can achieve the objective before starting the scientific project, like selecting the students. Now that we almost selected all of the postdoc students, we will start the scientific organization. So we will keep having 2 meetings per month, that's sure. We can have more or less depending on the situation. So if you want to be included, Thumbi, please. There is already Motunu. At some point, we got some problem with the email of Motunu where she was not receiving the notification for the meeting, but then it was okay. So we will keep that. We are already doing this, but yes, it's true, starting from now, because we have developed almost everything, we need to, all of the PhD programs are ready, even if we don't have 2 candidates, still need 2 candidates, more 2 candidates. We will work now more on the scientific parts. I think 3 of the partners received their money, still 2, this 3 other 3. It will happen soon, I'm sure. We are working really hardly on that to be able to give financial support to our students and our postdoc. How to say this? We will try after this maybe to meet to write a report, not really an evaluation about what we have done, but what we will need to do and how the student will meet. And we will include them at the first meeting and see with them their preference, how they want to work together, how they want to keep working together. And then they will have their own rule, their own meeting. We don't have to be included. They will invite us if they want. And as you said, each month, one of the students must present, or several of them must present how they advanced in their work, certainly. What do you think about that? Is that great? And we can meet more. We can find other funding for organizing.
Just to add something about the tickets for the next year meeting. I think we have already discussed on that, so maybe they can think right now for during the next, school in, for example, in Cameroon. There will be a PhD session where they will present all the job they have done during the year. So they have to focus it right now. What do I present in Cameroon for the next year? So you have already a challenge.
At the end, the last school, you will be the one teaching.
Yes, exactly.
They already started. They presented several projects during the school. Yeah. Do you have other? You want to say something?
Yeah, just for the student. What for student and for the other, for all the senior. The next step. The next step now is we need to have the, I would say, rewritten PhD subject, final version, by the end of, let's say, April. This one. Second one, we can have, I would like you to have a clear vision of the period, of the traveling period. They will spend 3 months in these countries at this institute and 4 months in the other institute. We need to have now a clear vision of the way you have the interaction between the different teams. 6 months, yeah.
Split that on 3 months. If the student want to split like 3 months. So the mobility is minimum 6 months. It's between 6 months and 1 year. For example, Jules with Vanessa. I am correct, Vanessa. Vanessa will spend 1 year, not just 6 months. So you can choose between 6 months and 1 year. If you want to split your period between 2 years, you will pay for your own ticket for the traveling. We will pay just for 1 ticket, and then you pay for the rest if you want to split the time. But we need to have that, and you need to decide before the end of April. Is that okay for you? Senior and student? May? Before the end of May? Okay.
No, let's say
not
end of April and the possibility of this extension to the end of May. Let's have it to end of April and then we can discuss.
Then it's end of April, certainly, Jules. You don't have to discuss. More questions?
We will send you an email where you have the detail of the mobility. Okay? And mainly what Demira said now.
Yeah.
6 months and at least 6 months, at max 12 months, and 1 plane ticket.
Okay,
6 months can be subdivided, but
yeah, between the 2 years, but you need to pay for more.
That means you can, if you want to be back to your own country for a certain period, so you can do it, but you need to stay there at least 3 months, 3 months, 3 months.
Yeah, we need to know this as soon as possible because we need to adjust the budget according to that.
You need to pay your plane ticket for your own money. But you need to stay there 3 months at least. Just, you know, why you have this? Just if you say less than 3 months, you will not understand what you will not learn what the habit of the problem, the habit of the other lab, the other institute. As you said, you can imagine you are in 2 countries where the plane tickets is very cheap, and so you will stay 1 month and then you go back for 2 weeks and then 1 month and so you will not learn. You will not learn exactly what the other is doing. I was thinking about Uganda and Kenya, but you have same things. Yeah, you can have same thing in other countries. So mainly the goal is to be immersed in other countries, another lab, other habits, other techniques, whatever, and other problems. This is the idea. So 3 months, at least between 6 and 12 months, and 1 plane ticket. And it should be done in the second year. It's okay? We'll write an email with explaining all these questions. If you have, if you would like to, if you would like to have questions, please send me an email. Be happy to answer questions. Okay? Let's finish.
Last comment or last question? If you don't have comments or questions, we are done. It's okay? Then you finished. You are free. We don't have meeting this afternoon. Just lunch and enjoy the rest of the day.
Yeah, you have to give the microphone to Jules.
Yeah, everyone.
Be the next organizer.
Yeah. Yeah. Last comment.
Yes, I will be happy to see you next year in Cameroon for the next summer school. Yeah. I think it will be the first week on the May. Yes. Next year.
We start, yes, we need to start thinking about, this is what you recommended, Jules.
Yeah.
Please explain that, about the training program, how we work on funding the students on the first course.
Funding money, much money, yeah. As soon as possible. We will start as soon as possible. Yes.
Thanks a lot. Last words, Slimane. You are the father of everything for me. Please.
Yeah.
For the next summer school, are we allowed to bring people out of AMAX, but fund for their? Okay, great.
So thank you very much. You worked hard during 2 weeks, and I'm very glad that we did it. We were able to do it. And thank you very much. Thank you very much to all the persons who helped us, and special thanks to Dellagi, who had a great help for, Santiago. Also, all the teachers who give a talk in these schools. We'd like to thank Nadia. She comes from Morocco to teach. Santiago from Argentina, and everyone. Thank you very much, and hope to see you next year in Cameroon. Or even before, for the senior, you can move, you have money to move, to travel. So please, let's use it. So, thank you, and goodbye.